Good morning, everybody, and welcome back. There's been a lot of news happening this morning. If you've not been paying attention, Governor Ivey held a press conference about 11 a.m. where she announced some changes to the state health order that we've been under for coming up on a year now. Now, there's some significant changes to this order. There's also several things that are staying the same. So we are going to recap it for you. If you didn't have time to watch it or if you didn't get those key takeaways, Dennis and I are here to recap that press conference, answer your questions, and tell you what is different. So, Dennis, thank you so much for coming on and helping me explain this, helping everybody understand what's changing after today.
Well, we'll do the best we can. I know there's still some, guidelines that still need to be set, and we'll kind of see how this all shakes out in reality. But we'll tell you what the governor said today.
Exactly. So I have some notes here. I have my phone here that I can look up the exact order. So when I look down, that is what I am doing. And Dennis has got the order from the governor in front of him. But let's just start out, Dennis, and talk about the main thing that came out of this press conference, and that is the mask order. Now, that mask order is staying in effect. Repeat, that mask order is staying in effect through April the 9th. Dennis, we know this was really a much talked about aspect of today's press conference. Many people believe that the governor would end that mask mandate. And some believe that maybe she would extend it for maybe just a set amount of time. And that's actually what happened. So masks are going to be in effect on a state level through April the 9th. Can you kind of talk about, was that expected from the health world? Is that something that surprised you? Or since the health experts are still saying that, look, masks work, did you kind of expect that order to be extended?
Well, I think a lot of people were nervous about that in the health profession. You know, all of the public health experts and doctors say it's too soon to let up our guard yet. And yet you've seen other states, Texas, Mississippi, for example, have gone ahead and lifted that order because, you know, things are looking better. Case numbers are dropping, you know, across, you know, really throughout the United States. And, you know, more people are getting vaccinated, and that certainly seems to be helping. But there's a lot of concern that, you know, people talking about you don't stop in the last mile of a marathon, right? That you know, we're making progress, but we're not quite there yet. And that's the message that's been coming from a lot of doctors and public health experts. So I think a lot of people were nervous once Texas and once Mississippi dropped their mask mandates that Alabama was going to follow suit. But Governor Ivey did not do that. She held the course, and she said, you know, we need to keep this mask mandate in place through April the 9th. But she did say in no uncertain terms that she is not going to extend this mask mandate beyond that date. So it is, she said there was going to be a hard cutoff on April the 9th, and that after that point, there would not be a statewide mask order in place in Alabama.
It seems interesting because when she was asked by a reporter at that press conference, look, what could happen prior to April the 9th that would maybe make you change your mind and say that you're going to extend that mask ordinance? She really doubled down and did not appear to have any sort of situation that would make her change her mind about that. She said masks go after Easter, I think was her comment. She said, we got to get through Easter, and then that mask mandate will not be renewed. Did not give any sort of qualifiers as to why that or not why, but as to if that mandate would be extended. She did make the comment that as of Tuesday, our 7-day average of coronavirus cases, Alabama's, is 778. That's the average 7-day case numbers. Now, that is a drop from the highest, which was on January 10th. And this is the lowest average since June of last year. So numbers looking good for Alabama. We do know that Scott Harris and the governor said that they have seen masks do work as opposed to a lot of things that we have heard. They doubled down on that fact. And the governor even said, once this mandate ends, she's going to continue to wear her mask. And she actually, I wrote down the quote, she said that she would encourage others to use their, quote, common sense and wear theirs as well. So it seems, Dennis, we're shifting from a mandate and an order to wear your mask to more of an encouragement after that April 9th date.
Yeah, and it should be noted, too, that just because, you know, once this statewide mask order ends, that doesn't mean that you won't have to wear a mask anywhere. Private businesses, potentially schools, there are going to be all kinds of places. You know, if you go to Publix, they could require you to wear a mask to get into the store. You know, and certainly in Texas and in Mississippi, we've seen particularly a lot of chain stores doing that. The store will require you to wear a mask to go into the grocery store. And then that will likely be the case, in Alabama after April 9th as well. So it's not going to be, as someone in my email inbox said, burn the mask day. That's not what this is. This is an ending potentially, or she says firmly, of the statewide requirement to wear a mask in public.
That's a good point you make, Dennis. It's not burn the mask day on April the 9th. There will still be plenty of private businesses that will choose to only allow in customers who do wear masks. It just will not be mandated at that state level. Question from Penny about restaurants. So Penny, restaurants were also addressed today in this press conference. And the change to restaurants is that there are no seating limits anymore at restaurants. Now, there had been a seating limit, I believe, Dennis, correct me if I'm wrong, that was 8 to a table. And that has been lifted. The new restaurant order or the statement about restaurants in this latest amendment to the order is that seating limits at restaurants will be lifted, but they still will have to have those partitions and the social distancing. So the occupancy limits essentially are lifted there, but there are still measures in place, according to the governor's office, that are going to make restaurant experiences safe. Is that the same thing that you're seeing in that health order?
Yes, and it's very specific that that either having partitions or having 6 feet in between tables, that requirement is still going to be there. So you can have, I suppose you can have those big party tables of more than 8 people. That would be allowed now, but you can't have other tables within 6 feet of each other. So that will still, it eases it up a little bit on the restaurants that are operating, but it's still, they would not be operating at full capacity unless they were designed to have their tables 6 feet apart or have partitions in between them.
Now, I know that if you have been going to restaurants, you might have seen these clear partitions that almost look like they're on a clothing rack that are a clear sheet of plastic that's coming down. That's what a lot of restaurants have been using, especially some, I know downtown Birmingham restaurants that already have close seating outside of the pandemic. That's how they made their money. So interesting aspects to restaurants here. Now, another change that comes, I think a lot of parents are going to have been concerned about, and that is summer camps. Dennis, tell us what you're thinking about summer camps.
Yeah, so it says that the order I'm going to read here now, says that the summer camps may open subject to social distancing and sanitation rules and guidelines. And it says those guidelines will mirror the one used for schools that have been open in person. So yeah, that's big news, especially because, as we saw, there were last summer camps in Georgia that were really the source of major outbreaks, especially overnight summer camps where you had a lot of people that were actually sleeping in the same cabin. They showed that the virus really spread a lot that way. So it'll be, we'll honestly have to do a little bit more research on what exactly is going to be required for summer camps to open. And whether they'll kind of take those situations into account and kind of designing ways to make it safe. But that was the announcement today that the state is not going to shut down summer camps. They will be allowed to operate this summer. So we'll have to look into that more and figure out exactly what that's going to mean for a lot of different places. They will still have guidelines and rules that they have to follow. So I guess it'll be up to the individual camps to see, how well they can do that and whether they can still operate within those guidelines.
Good point, Dennis. I'm looking through all of these comments coming in. That's what I'm looking at on the side here. And a question here from Angel said, if you're working at a restaurant, are restaurants still going to have to wear masks? So Angel, right now that mask order, the statewide mask order is in effect through April the 9th. After April the 9th, the governor made it clear she will not extend the mask order for the state. That means, though, that private businesses, private restaurants, they can still make their own decisions about what they're going to require employees to do. Jobs can still make those decisions. So you're going to have to check with your specific employer if you work at a restaurant to see what their plan is. Again, this just came down today. I wouldn't expect them to have a plan today or tomorrow about this, but the governor made a point during the press conference that, look, from today, March the 4th, more than a month, 5 weeks actually, through April the April the 9th, excuse me, that is that time period where now restaurants, businesses, and other places can decide if they are going to decide to enforce mask mandates, if they are going to require masks, or what types of other measures they're going to require. So you work at a restaurant, they've got 5 weeks to figure that out. As of today, if you go out to dinner tonight, yes, they are still required to wear those masks. Let's see. There a question from Ethan Dennis that you might be better to answer. He says, is there anything in the order about churches?
I did not see anything in the order specifically mentioning churches, so I expect that status quo will stay here. Maybe if you can get another question, we can come back to that in just 1 second.
Question here from, let's see, Kimberly. That's not 5 weeks. That is actually 5 weeks, Kimberly. From today, the 4th through April the 9th, 5 weeks. The governor really stressed she wanted to get past April. Another thing that has changed here that we can talk about while we're looking for that church question is senior centers. We know that our friends and our family who reside in nursing homes and those who attend group gatherings at senior centers have all been very affected by the pandemic. So one change coming there is outdoor programs at senior centers are going to be allowed. Again, that's outdoor programs at senior centers will be allowed. There are some kind of qualifiers in there, but that's kind of the baseline of those outdoor activities. We know that a lot of our seniors have missed out on some of those opportunities. So those will be coming back. Another note on nursing homes. This is an interesting change to this order that Dennis can probably explain a little bit more about, but they are raising the number of visitors and or caregivers that can go to hospitals or nursing homes from 1 to 2. So that means if you have a loved one in a hospital or nursing home and you were the only one that could go see that person and your brother, your sister, your husband, your wife couldn't go, that number has been raised to 2. Dennis, though, there's a little bit of a qualifier on the nursing homes. Can you explain that?
Yes, so the visitation is the same. Another part of this announcement today was that senior citizen centers, as they were described in the order, they will be able to do outdoor programs, which I guess had been kind of prohibited under the previous order. Governor Ivey talked about this will help, encourage people to be more active and be outdoors and that kind of thing. This one was still, it says they'll still be subject to guidelines by the Alabama Department of Senior Services. And again, we don't know exactly what those guidelines are going to be, but it does open up some additional options for senior citizen centers, for residents there to kind of, to encourage them to get up and get around and get moving, which are all good things. And hopefully the guidelines put in place and many of the nursing homes were among the first places vaccinated in the state too. So hopefully this will allow those residents to get up and get active and to do it safely.
A couple questions I want to get to in a minute, but I have several people who are talking about death numbers. Paige keeps mentioning it, so I'm gonna go over these numbers that Scott Harris, our state health officer, gave us just quickly, and then we'll get back to the questions. That information, I'm going to read this verbatim so I get it right. Over the last 5 years in Alabama, the average number of deaths was between 51 and 52,000 people a year. Again, 51, 52,000 Alabamians have died each year for the past 5 years. That's the average number. The 2020 projection not completely finished, but Dr. Harris said that the 2020 projection in deaths is over 64,000 deaths. So we know. We have heard from people, I'm sure you have too, that the death numbers haven't reflected changes in COVID, but Scott Harris really made a point on that today. There's been 11,000 more deaths projected in 2020 than that average number. He did not break those down into saying X is traffic deaths, X is flu deaths, et cetera. But he did say 11,000 more Alabamians died projected in 2020 than other years. So wanted to go ahead and put that out there. Dennis, do you have anything to comment on that or clarify on that while I go through these questions?
Yeah, no, I think it's a good thing to bear in mind because, we saw a story out of Louisiana that their statewide deaths increased by 30%, from their average to 2020. And he also said that our deadliest COVID days were in 2021. They were after the new year. So even in 2020, before really the worst, absolute worst wave of COVID hit us, we were still 11,000 or more deaths above average. And you hear a lot of people say that they feel like the COVID deaths are being overcounted. That they're worried that people are trying to make this sound worse than it is. But actually, the numbers suggest the opposite, right? The numbers suggest that we saw more total people die this year, or I'm sorry, in 2020, and that COVID, the numbers that we're counting now as COVID deaths don't even fully account for that. So it's really just kind of a stark look at everything, and you would think that maybe if people were driving less, if there were fewer miles traveled, as they certainly were in the early months of the pandemic, then maybe there would be fewer even traffic fatalities as well. But I think it is a sober reminder that I mean, there's 10,000 Alabamians that have died of this disease, and that's a huge deal. You can't try to brush that away and pretend like that's not happening.
Question from Edward. After April the 9th, will hospitals have to decide whether to mandate masks and to allow more than one visitor? Edward, after the 9th, you're correct. Hospitals will have to decide about their mask mandates. Those private businesses that we've talked about, restaurants as well, will have to make that decision April the 9th and after. About the visitors. Now, the governor said that she was ordering nursing homes and visitors two people to visit. So from 1 to 2 is seemingly, I believe, tomorrow, if I'm wrong, but I believe that begins tomorrow. So the hospitals will not have to decide that April the 9th. That's going to go ahead and visitors from now through the 9th. It's just the masks is the 9th is that key date. Question here about vaccines. Dennis, I have some information on vaccines. I know that has been your something you have really focused on for the last, it seems like ever, but I guess for the last 6 months, that has really been the beat you've covered. Tell us where we are on vaccines, where Dr. Harris said he expects us to be by April the 9th.
Yeah, I mean, it's weird. We've only had vaccines in the state for about 3 months now. So it feels like longer, but this is really, this is a relatively new thing. We've only had vaccines for 3 months, as Dr. Harris said, which is kind of wild to think about it. The state, he said, now last I checked, the official state dashboard and CDC numbers haven't been updated to reflect this yet. But he said Alabama's given out its 1 millionth dose of vaccine, which, hey, that's great. Over, I think we're getting close to 700,000 Alabamians now who have gotten at least one dose. Most of the 2 vaccines we've been using all along require 2 doses. So some people are going to have to still go back and get their second shot. But that's more than 1 in 8 Alabamians now has had at least 1 shot of the vaccine. So we're getting up to the point, now 13-ish% of the population. That's a significant chunk of Alabamians who, hopefully are going to be protected and going to be kind of taken out of that chain of transmission, because, the virus to spread, it has to have someone to spread to, right? So you have to have an infected person, and then they have to transmit the virus to someone who doesn't have it. And the more people we can get protected, either from vaccine or because they've already had it and recovered, then that starts to break up that chain. There's not as many places where the virus can spread, and that's when you really start to see the case numbers go down. And hopefully that's what we're starting to see now. And hopefully 5 weeks from now, as more people get vaccinated, and sadly as more people catch the disease and recover, there won't be as many places for it to spread. So we'll start to see that chain of transmission break down. It's kind of like a fire that doesn't have any fuel. If there's nowhere for it to go, then it starts to die out.
Good point, Dennis. Question from Megan. Megan says, this seems arbitrary. Megan, I think you're right. There doesn't seem to be anything special about the date, April the 9th, other than that's the one that's in the order. You're right about that, Megan. The governor did just say she wanted to get through Easter. That seemed to be her benchmark. Question here, a good question from Alita. She says, what about the VA? Is it still one person allowed in with a veteran? Alita, that would fall into the hospitals, I'm assuming, which starts, I believe, tomorrow, and that is raising that visitor limit to 2. So from 1 to 2. So you and somebody else, if you are going with a veteran, there can be two persons with that veteran. Question here from Dana. Dana says, what about concerts? He's talking about concerts at BJCC, Oak Mountain, and other venues. Dana, do you have it? Not Dana, excuse me. Dennis, do you have anything you can add about concerts?
So the concerts and those venues, that is not changed under the order. So kind of we're still at the status quo. I expect when we get closer to April 9th and this mandate expires that, the governor will make more announcements and potentially modify this health order even further. There might be some additional, that might open up a little bit. But I think we'll know more about that in 5 weeks. As for right now, today's order did not change anything regarding entertainment venues, live music, that kind of thing. Maybe in 5 weeks, if these case numbers continue to drop like we have been seeing so far, maybe at that time they'll decide to go ahead and open that up a little bit more.
Questions here about after the date, can you still wear a mask? The answer to that is after April 9th, you still, of course, can wear a mask. That's your personal decision. And the governor even made the point, she said she will still wear a mask after April the 9th, and she encouraged others to use, quote, their common sense, end quote, and wear theirs too. So the governor does seem to be really pushing people to wear masks after that April the 9th date, but she's just not going to require it. But you are obviously still free to wear your mask if that is what makes you feel comfortable. Questions also about the changes after April the 9th about restaurants and other facilities. I think Sheena asked that question. Sheena, we don't have any other data or information on that. We do know that April the 9th is when that mask order is going to end. We don't know any other changes that are going to happen then. I think it's safe to say we will hear from the governor closer to that date and get a little more information there. But the restaurant changes today were that the seating limits at restaurants have been lifted. Still has questions and or 6 feet between tables, but those limits on seating have been lifted. Now, Dennis, I know that there was also some talk about how many vaccines are we going to get in Alabama between now and April the 9th, this date that the governor has kind of drawn in the sand. Scott Harris had a projection. Can you talk about that?
Yeah, I can. He's so in the recent weeks, just this past weekend, the Johnson & Johnson vaccine got approved or got authorized for emergency use. That's that one-shot vaccine, which is logistically a little bit easier because you can give it out in one shot and you don't have to put it in that deep freeze storage like the Pfizer vaccine. But that vaccine has been authorized. We got a one-time 40,000 dose allocation of that vaccine. He said we probably won't get any more of that in March because they did not kind of have these pre-manufactured stockpile. They're having to manufacture it now. So that will start coming out, maybe not in time to do this. Right now, he said the state, they're shooting to give out about 150,000 shots per week. And that includes first doses, second doses. We're getting a little bit more than 100,000 first doses of the Pfizer and the Moderna shots now. And then with the remnants of the second doses, that adds up to hopefully more than 150,000 doses each week. There's hope. That number has kind of been steadily increasing in the past few weeks. We get, they say that they're improving their manufacturing processes. They're able to produce more doses and to get them, out a little bit ahead of schedule. So the amount of doses we're getting are kind of steadily, not dramatically, but just kind of slowly increasing as we go week to week. But even so, with that 5 week time frame, that would give us about another something like 750,000 shots. That we give out, and potentially, hopefully, would get up over having more than 1 million people vaccinated at that point. And that, I think the hope is there that having that vaccines, we're not anticipating like a dramatic increase in the number of doses we're getting out, just because we're not getting that many more doses to give out. But I think just kind of 5 more weeks of this kind of steady process, 150,000 shots or so a week, will help get us up closer to those thresholds where more and more of the population is vaccinated.
Going to get through a couple of more questions here. And one is from Trisha. She says, after the mandate expires, are companies still going to require their workers to wear one? Trisha, that's a good question. And yes, they can. Will they? To be determined, and that's per business, per company. So you're going to have to check with that place, but they definitely are able to. Question here from Edward. He asks about CVS, Walgreens, Target, saying that those large corporations, he's heard, will continue to mandate masks worn in their stores. And we think that other big corporations will be doing the same? Dennis, what's your take on that?
Yeah, I think we're going to have businesses, companies, large and small, are going to have some hard decisions to make when the state mandate ends, right? Right now they can just say we're requiring masks because we're under a statewide mandate. So easy, we have no choice. The decision is made for us. After April 9th, every business, every store, large and small, they're going to have to decide, do we want to require masks? Do we not? And I think that's going to be, you're going to see decisions kind of all over the place, because there are a lot of people who are sick of the mask mandate. They don't like it. They just want to be free to cough and breathe on anybody they want to. But then there are a lot of people too who are like, I don't want to personally go to a store or a bar or a restaurant that doesn't require masks, because, like I said, my mask protects you, your mask protects me. So if I'm going to a place where other people are not masked, that's putting me at greater risk, because I'm breathing in all of the droplets and the particles that they're breathing out. So I think there's a lot of people are frankly going to want grocery stores to require customers to wear masks, and so that I can feel safe when I go to those places. And that's going to be certainly kind of a double-edged sword there. There's a lot of people that are not going to be happy either way. And then it's going to be up to each individual business and, school, employer, all of these places now that have had that decision kind of taken out of their hands by the state action are now going to be in charge and going to be making those decisions themselves.
Last question here. I'm going to take from, I believe it was Sheena. She said, any idea when people with underlying conditions can get their vaccine? Sheena, we do not have any information on any new guidelines coming out for Alabama about who's eligible for their vaccines, but we are hoping to get that sometime fairly soon. And as soon as we do, we will make sure we share it with you. Dennis, thanks so much for coming on, breaking down this order. I know there's a lot happening, but hopefully we answered most of the questions. If you didn't get your question answered, please let us know. Feel free to email Dennis or myself, or drop it here in the comments. So Dennis, thanks again. Everybody, be sure to keep up on AL.com with these changes and anything else for your coronavirus news. Thank you. We'll see you tomorrow.
Thanks.